Dr. Arnold, you're here because you believe that chiropractic care can actually help kids with certain disabilities. Some are mental, some are physical. Very curious about how chiropractic care can actually help those with some of the mental disorders. Can you go into detail?
Sure. In chiropractic, we approach children in particular. Our goal is to be real mindful of their nervous system, how their nervous system works. The basis of what chiropractic is based on is the fact that there's nerve pressure in your spine. When you talk about special needs kids, be they ADHD, ADD, autistic, asthma, whatever, any of those children should, from a chiropractic standpoint, should be checked on a regular basis regarding their nervous system and their spine. It isn't that chiropractic is a cure-all for things like this, but in a case where a child has special needs or they have mental issues that they have trouble with being cognitive or thinking straightly or whatever, adjustments help that nervous system to function better, which is going to give that child more advantage than if he doesn't get his spine checked.
All right, so what you're saying is that through adjustments, you know, some of the nerves that kind of goes into the brain that might affect something like an ADHD or an ADD, you know, chiropractic care can actually help alleviate some of those?
Sure. When you think about your nervous system and how the impulses travel from your brain down your spine, okay, if you have issues in your upper cervical spine, and most children, they're born pretty traumatically, so it's been documented time and again that children have issues with their neck post-birth due to the fact that they get pulled on, yanked on, whatever, on their way down the canal. What our goal is to relieve that nerve pressure up here to make sure that your child gets all the impulses they need to make their body work. When it comes to adjusting upper cervical, yes, it affects how your brain functions and just generally all the way to the cell level how your body's going to work.
Okay, and special needs, we kind of cover on the mental. Now, some of the physical special needs that some kids have, how do you address those through chiropractic care?
Well, let's say the child has special needs in a way that they have difficulty walking or they have difficulty with their motor skills. There again, if they have trouble on their thoracic spine or their lower back, you have to, if we clear those out and adjust their spine so those nerves can work like they are supposed to, then that makes their walking better, makes their motor skills better, and generally gives them a better life.
Okay, and you know, I think a lot of people, especially if they are wheelchair bound, you know, people kind of assume that, okay, they can't walk, period. How can chiropractic care at least help those types of kids that maybe they don't have a chance of walking?
Well, I think that once a child's wheelchair bound, I think parents and the medical profession don't give them a lot of alternatives to what they can do in their life. We have patients that come to our office that we literally help out of the wheelchair, get them on the table. The purpose, again, is to do whatever we can do to make their body function better, make that nervous system work better. We're never promising to perform a miracle and all of a sudden they're going to be walking. However, things like that have happened in the past. I mean, things can happen like that. When you address things in the spine and get the nervous system working the way it's supposed to, it's just beyond our imagination what can happen.
Okay, and Dr. Arnold, what's the difference between when a kid comes in and you give them an adjustment and an adult comes in and you give them an adjustment, other than maybe, you know, maybe some of the pressure points might be a little bit different? I mean, how do you approach those two age groups?
Well, it's true. As a child comes in, say if they're under 5, we hardly ever x-ray a child under 5 just based on the fact that we're going to rely on our instrumentation and our palpation and what we see and feel. When it comes to a child beyond 5, 6, 7, if they come in with issues of some of these that we talked about, autism or whatever, we like to see what their neck is doing. Now what we'll try to do is adjust them a few times, see how they respond. If they don't respond like we'd like them to, then we give the parents permission to take some pictures of them so we can see. As far as the force of an adjustment, very gentle. You know, it's sometimes a misnomer that people picture that chiropractors kind of rack and stack and beat on you, and that's not true. We're very specific about what we do and how we do it, especially with a child.
Okay. And once again, just kind of review, some of the physical, some of the mental disabilities, how effective can chiropractic care be?
Well, we've had some young kids that have been coming to our office, say, for 4, 5, 6 years that have been diagnosed with ADHD or ADD. Their parents definitely see a difference in how they perform as far as their activity levels and how they handle school or whatever they do on a daily basis. It's just important from our standpoint to do whatever we can do to make that child's life better. And I know that the parents that take the time to bring their kids would always say that they definitely see a difference in their child, a benefit for their child.
How can parents determine if their special needs child, or really any of their children, need or could use chiropractic care to help them live a better life?
Well, from our standpoint, you know, every person should have their spine checked because your nervous system is what makes your body work. So in the case of a child, especially in a situation where they have issues, what better thing can you do as a parent than to bring them in, have their spine checked, adjust them accordingly, and give that body every opportunity to function as best it can.